Hello, this is Dr. Gay from First Look MRI, and this is a 68-year-old female with complaints of foot pain and ankle pain, and she has several findings, but the most significant one, and the one the physician was worried about, is a tear of her plantar plate, which is a band of tissue along the bottom of the metatarsal phalangeal joint, and it's part of the joint capsule, a thickening along the plantar surface. We call this the plantar plate. Now in this view here, this is the second toe, third toe, and we can see the difference between the plantar plates. This is a plantar plate down the bottom here. And they look actually very good on this view, but if we go more distally, if we get the right direction here, we see that there's a foggy area of brightness here. This is the second metatarsal phalangeal joint, and instead of having a nice dark band along the plantar surface, we see continuity here, but a tear over here. So I have a tear of the plantar plate of the second metatarsal phalangeal joint. Now this is kind of hard to see here, admittedly, so we're going to go to another view, a sagittal view, to see if we can see it here. So this is the second toe. Here's the tip of it, the distal phalanx, middle phalanx, proximal phalanx. We see that there's a foggy brightness here in the bone. This is meroedema, and usually they have meroedema of the second metatarsal head. This is one of the few cases I've ever seen where they have not had edema in the head. Instead, it's in the proximal phalanx here of the second toe. They have a little bit of white here. This is fluid in the joint. And we see a flexor tendon. You see this dark band coming off the distal phalanx. Comes across, down. This is the flexor tendon that goes up into the foot. And adjacent to that, we see a torn plantar plate. So again, that plantar plate is part of the joint capsule, thickening along the bottom. There's a little hole in it right there, a little gap. If we roll off to the lateral side, this is part of the plantar plate. Off midline, here's midline. Off midline laterally, that's where it looks really foggy. Here's midline again, there's a little gap. We go off to the medial side, and the medial side doesn't look so bad. It's more dark, more uniform, so it looks like part of the medial side is holding on, but the central and lateral portions look like they are torn. But the best way to look at this is on another view. I'll show you that in a second. Let's go to the third toe just to see if what this third one looks like. So the third one looks very good. We have the flexor tendon. We have the plantar plate deep to that, kind of around it really. And if we go off to the one side, medial side, things are nice and dark there. If we go to the other side, things are nice and dark there, nice and tight. So this looks like a normal plantar plate. But I think the best way to look at these is on the coronal images. This is a coronal image. We can see the great toe here, and here's the second, third, fourth, fifth toes. These are the metatarsal phalangeal joints. If we go along the plantar surface again, there's the joint capsule and the thickening of the joint capsule, the plantar plates along the bottom. They will show a little dark band. It looks kind of like an inverted smile. Again, that's that plantar plate and joint capsule hugging the bottom. If we go up into the joint, they were into the joint, and we're going to go down again along the plantar aspect. So we're going to look for this dark band following the contour of the metatarsal head. So this looks normal. There's a band right there looking totally normal, nice and continuous. And then we get to the second plantar plate, and we see it looks like it's shifted. So it's torn right here. There's a big hole in it. And this is the plantar plate. It looks like it's pulled off to the medial side. Here's it way down here instead of hugging along the top. So we see that this is a ruptured second plantar plate, and it's drifted off to the medial side here. And these are pretty easy once you know that this is the view to look on. They can be pretty easy. So if they say rule out plantar plate tear, you just go to these images, look on the plantar surfaces, come up one cut, and see if you see that inverted smile or not. Yes, yes, no. So ruptured plantar plate of the second metatarsal phalangeal joint, and this is the plate drifted off, and that allows for dorsal subluxation of the second toe there. And usually they have meroedema throughout the second metatarsal head because it puts abnormal stress on that metatarsal head, but this patient does not have that. Now, just incidentally, this patient has a couple other findings. I'll show you really quickly. This is a sagittal image of the ankle. I just scooted the patient over, and we can see here along the lateral side, this is the fibula, and along the fibular side, there's two tendons that come down. The peroneus longest, back here, this dark one that comes down, makes a turn. Here, this is just an artifact where we lose it. But right in front of it, we should see another one called the peroneus brevis tendon. And this peroneus brevis tendon, if I zoom on up here, is right in here. Instead of being nice and dark like the longus, it's gray and severely attenuated. This is a high-grade partial tear of the peroneus brevis tendon as it loops around the ankle. And just another finding in this patient, they also had a partial tear of another one over here. If I zoom on back, this is called the posterior tibial tendon, and it is also gray right here. So they have tears of ankles, tears of tendons on the medial and lateral sides of the ankle, as well as this plantar plate tear. And that's it. Thank you very much.